Welcome to Mission Ready, the VA Disability Podcast. It's the show where we break down the complicated VA process into bite-sized, understandable conversations. I'm your host, Dr. Marshall Barr, physician, disabled combat veteran, and founder of Extera Health. The reason we started this podcast is because we know the VA system can be complex, confusing, full of red tape, and a lot of veterans feel very disenfranchised. So whether you're starting the process for the first time, you're in the appeals process, or you just want to learn more, this show is designed for you. Today's a big one. We're talking about PTSD, what it is, what causes it, the ratings, what you can do to make a better evidence-based claim. I'm joined today by my co-host, Alicia Gomez, one of our licensed mental health providers at Extera Health. She's actually helped countless veterans through this process.
Great, thanks. It's great to be here. Like Marshall said, I'm Alicia Gomez. I go by Allie. I'm a licensed clinical professional counselor. I've been doing it for a little over a decade, and like you mentioned, I've been doing this for a while. I've walked this process with multiple veterans.
Yeah, you're from the Windy City, right? Chicago?
I am. I live and work out of Chicago currently.
Man, well, it's good to have you here.
Thanks. Great
to be here. Big one today, right?
Big
PTSD. It's on a lot of veterans' minds, literally and figuratively.
Yep.
And it's a big claim, that issue that a lot of veterans have.
Yeah.
So we really wanted to make that second episode because it should be really one of the top topics we talk about.
Yeah.
So can you, for a veteran going through the process, can you break down, what is PTSD? What does that look like? What does the VA define that as?
Sure. PTSD, post-traumatic stress disorder, it involves witnessing a traumatic event, and we can get into what, a traumatic event means later. And there's typically 4 different pieces to PTSD. There are intrusion symptoms, so like, the classic nightmares, intrusive, I'll get to that. Nightmares, flashbacks, things like that. We have avoidance symptoms. So you might avoid places, locations, people, situations that remind you of the event that you experienced.
Yeah, it's a big one I see.
Yes.
Socially isolate,
Yes.
Don't want to be in public, no big groups.
Mm-hmm. Yeah, that's actually a huge one. Negative alterations in your mood. So feeling depressed, having guilt, feelings, just kind of having an overall general negative outlook on things.
Yeah.
That's a big one. And I think that's actually kind of an overlooked one often because people want to kind of push that aside. And then the 4th one would be alterations in your arousal. So you have increased startle response. You're easily startled by things, fireworks, cars backfiring.
I mean, that's classic what you see all the time.
Yes.
Like in the movies, like, oh, fireworks, I can't handle it, right?
Right.
But it's anything really, right?
It can be anything. Yeah, it can be any loud noise. It can be, a kid crying could trigger something that happened, during your time in the military. That can also include, reckless behavior, driving recklessly, engaging in behavior that you may not otherwise
Sexual
have.
promiscuity,
Absolutely.
gambling.
Yeah. So a lot of times people get arrested for nonsense and vandalism, things that they wouldn't otherwise have been doing.
And to go back to that mood and the hyperarousal you talked about, how about irritability? Is that one that you see a lot?
Definitely. That's actually a huge one that people don't realize, I think, is a pretty classic symptom of PTSD. Irritability tends to go a lot with depression, but it's also a classic symptom of post-traumatic stress disorder.
Yeah, I often see, and I have PTSD, and so that's a big thing for me is sometimes the stimulus that's coming in at me does not match the output that I'm doing, right? So something minor, a minor infarction, and then all of a sudden I'm blowing up, right?
Yep. And
so I hear that a lot with a lot of the vets I'm talking about. Is that something you're seeing too?
Oh, definitely. I've spoken with a veteran who has said things like, my kids, basic things like kids running around the house screaming and playing. He just overreacts and he blows up because of it. It's an everyday thing that everybody experiences, but it can be frustrating to anybody. But if you're experiencing PTSD, it doesn't fit. Your reaction doesn't fit.
It's horrible because it doesn't just affect the individual; it's the family too. Right. The VA is it's weird, right? So the VA has this whole disability handbook and how they rate things and disabilities and who can see you for what and evaluate you for what. All of them are pretty straightforward. Anyone can see you for them and evaluate them as long as they're a medical provider. However, in the handbook, the CFR 38 Part 4, PTSD is its own standalone area. It's unique in who can actually diagnose it, right?
Absolutely, yes.
Tell us about that.
The VA wants the diagnosis of post-traumatic stress disorder to come from a VA contracted psychologist or psychiatrist. So what that means is it has to come from someone who works for the VA or is contracted by the VA. So someone like me, an independent contractor or independent person, would not be able to give you the diagnosis of post-traumatic stress disorder for the purposes of a VA disability claim.
I mean, I see this a lot. I'm sure you do too. When you're seeing someone for a Nexus letter, is hey, can you diagnose me, right? And even though clinically you're legally allowed to diagnose them, for this purposes, you cannot.
Correct. I cannot.
And it's a big thing to note, right? So if there's other people out there, maybe it's your own PCP, another company saying they can do this for you, you gotta be careful because that's a lie.
Yeah.
Right? The big issue you run into is maybe your claim goes through. If your chart gets audited and they see it wasn't by a VA contracted psychiatrist or psychologist, they can null and void your case. And you can owe that money back.
Right. We don't want that to happen.
A lot of vets, when they go through the process, they're always usually gonna end up seeing a contracted psychologist and psychiatrist because the compensation and pension exam.
Sure.
Yeah. So, if you make it to that point where you're getting a CMP exam, you can expect you're going to see some kind of board certified psychologist or psychiatrist.
Correct. That obviously would qualify as an appropriate person diagnosing you with PTSD. That's what you would need to move forward with the Nexus letter.
So if you want to improve your chances of getting PTSD connected, again, you got to go to the VA, go see your psychiatrist, psychologist, and get your diagnosis.
Yeah.
So PTSD, I think especially in the military, a lot of guys, even in the military, and a lot of non-military folks, often equate it to being, you can only have PTSD if you're in combat.
Common misunderstanding.
Why? Tell me.
You don't have to just see combat to be diagnosed with PTSD. There are a lot of other things. Witnessing an accident, maybe there's a training accident, someone gets injured, or God forbid someone gets killed. That can constitute a diagnosis of post-traumatic stress disorder. Hazing within the military.
Really?
I see that so much. Yes.
Have you had cases of people?
Multiple cases of people who have been experiencing hazing.
Which is crazy because, I came from the Ranger Regiment and hazing was kind of a normal thing.
Yeah. Yeah. I mean, it happens. I get cases like that all the time. Something happens, the hazing in the military, and it really affects them, and that can give you a diagnosis of post-traumatic stress disorder. Things that you've done in the military. I've had cases where someone joined the military for one reason, hoping to do good, and they felt that, that sending refugees back to the country they came from.
Really?
Mm-hmm. They were so upset about doing this, sending refugees back into the country because they felt that they were not doing good.
It's so fascinating. 2 people, 10 people can go through the same stressor.
Yes.
And 9 out of 10 are fine.
Right.
But one person it really affects.
Yeah.
Why is that? Do you know? I mean, does anyone know?
I mean, no, there's not like a clear black and white answer to that. It just depends on the person. Some people, everybody experiences things differently. Everybody processes stress and, different life situations in a different way. So what might affect you may not affect me, and vice versa. What might affect me might not even phase you.
Anecdotally, that's true, right? I mean, I was on several missions that were very traumatic, exposures, and some of my people and my platoon, my buddies, totally fine, and then others totally crippled and they're like stuck in that moment. And there's different degrees of PTSD, right? Different levels of severity. Mm-hmm. It's not one size fits all.
Not one size fits all. No, there's definitely, you can have people that can still function, have post-traumatic stress disorder, have some of the classic symptoms they experience. They may or may not be getting help for, but they're experiencing the symptoms on a daily basis, and they can still kind of function okay in society. Then you have the opposite end of the spectrum, that people are just so crippled by the symptoms that it's hard to function appropriately.
You said something earlier about non-combat related PTSD. One that I'm seeing a lot more of, and maybe you can attest to it, is MST, which is military sexual trauma. Yeah. And I think we're seeing a lot more because we're seeing the needle move on how many more females are coming into the fighting force.
And not just females. I've seen it in males as well. Yeah, it doesn't have to be just females. Well, it tends to be very common, more common with females. I have definitely seen it in a fair number of cases with males as well. But you're right, the needle is moving. That's starting to be more recognized as something that does happen.
We had mentioned already about levels of severity, and that's important because we get into rating, right? So if a veteran gets service connected for PTSD, then it's going to go to the rater, and they determine 0, 10, 30, 50, 70, 100. Mm-hmm. You speak a little bit on some of those nuances about how they determine level of severity when it comes to rating.
So they focus a lot on how severe it affects different aspects of your life. So they're going to look at social functioning. Do you have any social life? Are you able to be around friends? Are you able to go do things with, family, social events, social gatherings? Do you stay in your house and isolate all day because you can't stand to be around people, crowds, noises? That's a big one. Occupational functioning. Are you able to maintain a job regularly, steady employment, or are you jumping all over the place? You're either getting laid off or you're losing your job because your symptoms are too intrusive and they're affecting your ability to maintain steady employment, which is actually a big one. A lot of people have trouble with this, with PTSD. Has it affected your personal relationships? Are you getting divorced because your symptoms are so intrusive or so bothersome that it's affected your other person? Are you not having relationships with your kids anymore because you were so irritable and so difficult to be around? People have left you. So those are the more severe cases, and the VA looks at that level of severity when they're
when they're talking to you and doing their interview. They're looking for certain things. They're looking at pre-military, during military, and post-military. How about your social, family life, occupational stuff, educational stuff, substance abuse, legal stuff. I mean, these are all things they're assessing to see how has it affected those, correct?
Right.
But a really, really big one, the elephant in the room that a lot of vets don't like talking about is suicide.
Yeah, that is a big one. That would obviously be on the more severe side of things. I mean, past attempts, current attempts, thoughts about it. Unfortunately, it's common with PTSD.
Yeah, and typically, if you're having suicidal ideation, suicidal thoughts of harming yourself, having attempted it, that's usually puts you in around that 70% rating criteria.
Yeah.
The problem I see a lot, and maybe you have too, is a lot of vets are afraid to talk about suicide.
They're afraid that it's going to affect them in some negative way. They're afraid that they never wanted to bring it up when they were in the military because they're afraid of losing their clearance, security clearance. I hear that all the time. And because there's a pretty common stigma in the military, you suck it up. You deal with it. You don't complain about it.
100%. Yeah. I remember I would get back from deployments, and they would ask, it's like 3 questionnaires, and it was, did you ever shoot your weapon? Did you ever feel like your life was in danger? Did you ever see anyone die? And it was like, well, if I check yes to all of those, then I'm going to have to see the shrink.
Yeah.
Right? And so everyone checks no, which is a total lie because, mean, we're in a special operations unit, seeing combat all the time. And but it just speaks to the culture of the military.
Yes.
And that's not just unique to Army. That goes across all branches.
All branches.
It doesn't matter if you're Coast Guard, if you're stateside, deployed overseas. It's just the culture of the military.
Yeah.
And even post-service, I think a lot of people get really nervous when they say they get asked that question directly. They're afraid, well, am I going to get pink slipped? Am I going to have to go be involuntarily admitted to a psych ward? Yep. If I admit to that.
Mm-hmm. Are people gonna know? Are people gonna think that I'm crazy? They say that's a sign of weakness. I don't want my family to know. If they're seeking help outside of it, I don't want anybody to know about this because that means I'm weak. And in the military, that's considered weakness.
Yeah.
It is not weakness.
Well, I can tell you right now, vulnerability is not our strong suit, all right?
Well.
So, a lot of us are working on it. But yeah, the bottom line is, you just need to be truthful. Don't lie about this.
Right.
But if you are having those thoughts, when you're being asked in that CMP exam or during an appointment with a provider that's asking that question, you need to be open, you need to be honest, and not be fearful of repercussions because they're not there to punish you.
Right. Even they can be active or passive, and I quickly want to talk about the difference between that. Active is meaning you're having current thoughts of it, you have a plan, you have something in mind. Passive could just be like, maybe I just don't feel like waking up today. Maybe I'd be better off if I wasn't here. My family would be better off without me, but not actively making a plan. But any of that can count as suicidal ideation.
Yeah. Well, let's stop being such Debbie Downers here.
Agreed.
Right? Now, remember, 2 things you need for a successful claim. You need to have the disability. Yeah. So we're going to assume everyone has been diagnosed with PTSD at this point, right? The second one is the Nexus.
Yes.
This is what a lot of people are lacking. Again, it's a lack of documentation in the in-service treatment records, right?
Yeah.
Especially if it's non-combat related.
Yes.
give some education to our viewers about how they can strengthen their claim so they can get, first-time pass rate, challenge a denial, get a pass in their appeal. So what are some things that you recommend?
The treatment records, for sure. I mean, not everybody has them. In fact, most people do not have them, in my experience, from their in-service time. But records afterwards, if they've seen someone at the VA or any kind of help they're getting, those records would be helpful. On top of that, buddy letters are pretty important. Someone talking, a wife, a friend, someone who was in the military with you, talking about someone maybe that was with you that experienced the stressor, and maybe if it wasn't verified, someone.
That's a really big deal, right? Because remember, this is a medical legal process, right? So if you don't have it written down in your previous records, then in their eyes, legally, it never happened. So at that point, you've got to create the evidence that shows you were there, right? So that's what those buddy letters are for. It's people that were there with you at that event, at that time, that witnessed that trauma.
Right. Yeah,
correct?
Yeah, definitely. That's key. I've had people do buddy letters. I've had people do news articles that their name was specifically listed in some kind of event that happened, which is actually really helpful because it places them at this specific event happening. Getting statements from friends, spouses who have witnessed your behaviors after you've gotten back versus how you were before you went. Those are all really key pieces of evidence, I think.
Yeah, people that know you well, right? So someone that can attest to this is him before military and ABC event.
Yep.
This is now him after the event.
Yes.
And how it's progressed.
Yes.
Because another big thing is we have to show chronicity, right, of the disease.
Yes.
How long it's been there and how has it progressed? And then continuity of care. Have you been treating it along the way, right? They're going to look for all these data points, correct?
Correct.
What about do you recommend doing personal statements? Is it worth the veteran doing a personal statement?
For PTSD, I absolutely think that it is. I think they can give a firsthand narrative, exactly of what happened and how they're feeling and what they experienced. You can get a certain amount from medical records, but sometimes, kind of like you said, people are not as forthcoming when they're seeing a psychologist or a psychiatrist for various reasons. But if they were to do a personal statement that really breaks down what they've been through, what they experienced, it kind of gives a direct story to what happened. Yeah. And I think that can be really impactful.
Now, this next piece of advice that I have is probably one of the most important pieces of advice. It's probably going to be one I talk about in every episode. It's, we talk about documentation, right? You, the veteran, should take advantage of your secure messaging feature on your electronic medical record you have with your provider. If you're in the VA system, that's your My Healthy Vet. If you're private, seeing a private civilian doctor, it's whatever platform that you can download on your phone or your computer. I say this because a lot of vets are like, well, I just called them and told them about this. Unfortunately, providers are busy. They don't write it down, and the veteran's assuming they wrote it down, and then when they go to apply, like, well, I told them about that. Why didn't they write that down? Leverage that feature to your ability. You write a message, and you can actually talk about the severity of your symptoms, how long you've had them, what you think they are from. They are from this traumatic event. So now you are actually creating the bridge, that nexus, and it's now in medical writing. And you submit it to your physician or your nurse practitioner, PA, any medical provider. And anything you submit electronic like that now becomes part of the medical record. It is part of the medical legal documentation, the paper trail that you're creating. And second, what does it do? It forces your provider within 24, 48 hours to respond to you. So, now you're getting a response from your medical provider. Yeah, that's something that could happen. So you frame the question, do you think my PTSD could have been from my event that happened overseas or that happened in the barracks? They respond, yeah, I think that's very plausible. There you go. Now you've got your nexus from a provider. Like
you said, it's in the record then, and it can be used.
Now, C&P exam.
Yeah.
That's the compensation pension exam. I think a lot of veterans are very familiar with it. If it's your first time doing any of this, you're not familiar with it, that's where you go in and you're evaluated by a provider. In this case, it's going to be a psychologist or psychiatrist, and they're going to ask you all the PTSD questionnaire questions, trying to figure out what caused it, how bad it is, what's your functional limitations. Mm-hmm. So any tips you have for our veteran viewers about how they can prepare for that to be successful?
Be honest. That is my number one piece of advice for those exams is to be honest. Don't over-exaggerate your symptoms. Don't under-exaggerate,
minimize.
Minimize.
Right?
That's the word I'm looking for. Don't minimize your symptoms. I mean, tell it how it is. If it's affecting you, discuss it. That's
a big problem though for veterans, right? Because I think we go along and we get conditioned to minimize.
That's right.
I'm fine. Oh, I'm good. I'm fine. It happens across the continuum of all veterans, across all generations. I see it all the time when I take care of veteran patients. Their arm could be falling off, and it's all right. It's just a flesh wound.
Yeah.
And that translates into mental health, right?
Mental health is much more minimized than physical health. That's a big thing. And I hear over and over again, it's the stigma. You're told to suck it up.
And that's what happened to me when I went in and did my claim for PTSD. I was really cautious about my answers. I minimized. Oh, I'm fine, because I'm a physician, and I was afraid that if I admitted to some of this stuff, what's that going to do to my license? What's that going to do to my professional career? What if someone finds out? And so I'm okay. I guess it's not that bad. And so then what happened is I got a 10% rating, and I had for a pretty severe case of PTSD. And so, that's let that be an example of what not to do. Because they're not there to do I gotchas or to say, we're going to report you or you're going to the psych ward. This is your opportunity, to claim your case, do your case,
right,
and get the help you need.
They're not there to judge. They're not there to take anything away. They're there to help you.
We talk about all these levels of evidence, things they can do, a veteran can do on their own to make their case stronger. Mm-hmm. But there are some veterans out there that still struggle to get connected for this.
Yeah.
And that's when we typically will see them at Extera Health. They're coming in, they've been denied, or they feel like their case is not strong enough for an initial application. And that's when they are looking, should I get an independent medical opinion or a Nexus letter?
Yes.
When do you think is a good time? When do you recommend a veteran obtain one of these?
A Nexus letter?
Yeah.
I think that if you don't have a lot of medical evidence, I think a lot of times it's harder to prove for non-combat situations. So early on in the process is, I think, the best and most effective time, because whether it's combat or non-combat, we can help you make that bridge that gap to the event and the current symptoms you're experiencing. So earlier is better.
When you see a veteran, right, you're not just capturing medical facts, right? You're actually capturing their story.
I'm getting a story.
Right.
Yes.
And so when you're writing your letter, you're creating a narrative.
That's right.
The story of their life, of the event.
Yes.
Which is imperative to the diagnosis and getting service connected.
And understanding how X event caused these symptoms. I mean, that is imperative to get their history, to get their background, their story. Were they struggling before the military? How have things changed since they've been in the military? What exactly happened and how it's affected them?
People don't like talking about this stuff, especially PTSD, because it's usually from one or maybe multiple events. How do you go about encouraging someone to seek out, you or someone that can help write a letter so they can get connected? How do they get past that barrier of self-selecting themselves out because they're scared? That's
a great question. I think there's no one correct answer for that, but knowing that, you served your country, you have done the most honorable thing that you can, and you deserve help and recognition for what you've been through. That's what we're here to do. We're here to help you. We're here to encourage you. Myself and any other therapist who's helping, do letters like this. That's what we do. We specialize in working with this.
High empathy, a lot
of empathy, a lot of patience,
non-judgmental.
Absolutely. Yeah. Right. Non-judgmental. We're not here to judge. We're not here to criticize. We're here to listen, take your time, tell us what happened, and we're here to support you.
You've been working with Xterra now for a while. What makes our letters different, compared to maybe someone else?
Yeah, I think that some of the things that make Xterra stand out are, the amount of information gathering that we do. I think that is key. We get the medical evidence, which I think other companies can say the same. But I think what really makes us stand out is that we do a lot of research on literature, relevant literature to this. I've done a lot myself personally. I'm sure you have as well. Looking at how PTSD can manifest, things that can cause it, combat-related stressors, non-combat-related stressors, and there's a lot of medical evidence out there to support what we're talking about. And I think that is really, really key.
We also incorporate legal cases, right?
Yes, absolutely. Yeah. I think that's also incredibly key.
I mean, it's important, right? Because it's a medical legal process. So if you find a case that has set a precedent that is very similar to that veteran situation, that should be taken advantage of because the VA has already set the bar. They set the standard.
Yes. Yeah.
And they have to weigh that case to that standard.
I would say that Xterra we do a lot of research, a lot of looking into cases and medical evidence and linking that with your specific case. And I think that really makes us stand apart from the other competitors.
So do you have any, anecdotal stories or cases that maybe were difficult, maybe had been denied before you worked on and had success?
I have had cases where people have been denied in the past, whether it's most of the time it's because they did not have enough evidence. So there was, the VA recognized that you had PTSD, but it wasn't linked to this. It was something earlier in their childhood or whatever the reason was. Through talking with them and going through the records, and sometimes they've had actual, I think I mentioned this before, they've had actual news articles or something that kind of shows the evidence that they were there. We were able to write a letter for that, talk about how it's in the relevant research, relevant literature and VA cases, and they've ended up getting approved.
What are some of the more nuanced or difficult ones you've done? I mean, that you've seen, right? Because I think that's a lot of people face the biggest barrier with non-combat related PTSD. And so I want our viewers to know who maybe who are struggling, maybe are not diagnosed yet, are diagnosed but have been denied. What are some of those nuanced, gray area non-combat related PTSDs?
I've seen military sexual trauma is a big one. I would say actually racism within the military. I've seen quite a few cases for that, especially Vietnam era. That was a common.
Really? In Vietnam? I did not know
Vietnam era veterans have, people of color have dealt with all kinds of struggles there, and I've done quite a few cases for that. Training accidents, if you can believe that, or they've witnessed an accident while in basic training. They haven't even gone out into the field yet. They're in basic training and they witnessed an accident there, and someone was severely injured. I think those can be a little harder to prove, especially if they don't have documentation that this event happened. But getting, buddy statements, this is the key time to get buddy statements, evidence like that. I think those are some of the more common non-combat. And then hazing, I mentioned that before, but hazing is actually a big one.
I want to go back to the military sexual trauma. And we're going to do a future episode on this and dedicate it to it. But, for our audience out there where this is an issue, right, a significant issue, how do they prove that? How do they say this happened? Because a lot of times there is no documentation. It's pushed under the table, especially back in the 80s and 90s, like that was, no, you don't talk about that.
There's a couple of different ways you can do it. Sometimes if a police report was filed, they can use that. But again, that isn't often the case. If a buddy statement, again, this is a big time for a buddy statement, they can witness your behavior before a specific event and then your behavior after the event. Because I would say 9 times out of 10, military sexual trauma is not documented, or unfortunately it will get reported and pushed under the rug because nobody wants to deal with it. People will say, I did report it, but it's not on the record because they didn't want to deal with it. So if they can get someone who was in the military with them at the same time to talk about how their behavior has changed, or just talking about it in your medical records. I've had cases where it wasn't documented, but the person spoke about it so many times in their medical records, they can show that it's repeatedly.
Can't understate it. You cannot do enough documentation. Document.
Yeah, that's key.
Well, Allie, want to wrap up here, but do you have any final thoughts for our viewers or, summarize anything?
I think the key thing to take away today would be, diagnosis. Make sure you have that diagnosis of PTSD. And documentation. We've talked a lot about documentation. Those are 2 key things. Get that going, and that can make this process much easier. And then the third thing I would say is get help early, get help soon. I want to stress again that I know it is ingrained in the military stigma that it is a weakness. It is not. You have worked hard for this. You have fought for your country. You are entitled to this. Get the help that's out there and it's available for you.
Well, thanks for coming. That's a wrap for today's episode on Mission Ready VA Disability Podcast. If there's one thing you can take away today is PTSD claims are complex.
They are.
They're difficult. They're nuanced, and sometimes they require help.
They do.
We're excited. Next week we're going to be talking about another big one that we see a lot is depression and anxiety secondary to tinnitus ringing in the ears. But until then, like and subscribe our page. Follow us on Facebook, LinkedIn. Check us out on our website, www.exterahealth.com. And until next time, stay mission ready.